right, hello everybody. Good evening. We're going to get started right now. First of all, welcome. Thank you all for being here. My name is William Mundo, and I'm a student here at the Colorado School of Public Health. And I have the pleasure and honor to introducing our wonderful guest speaker. I guess just before we get started, I want to take the time to recognize this special week that we all have, and recognizing the importance of public health and how critical it is to really, take a stand during these times of uncertainty. And today our guest speaker will be talking a little bit about that. So Mr. Tony Mazzaschi, he is currently the Senior Director for Policy and Research at the Association of Schools and Programs for Public Health. Also, you could abbreviate it as ASPPH. He's also going to be talking about early career training, professionalism, the current environment of new professionalism in public health, education opportunities, and much more. Tony joined the ASPPH on April 1st, 2014, and through his role there, he's been advocating for the policy positions. He's also been advancing the capacity for research of faculty members and conducting prevention-oriented research. He also authors a weekly digest of federal policy and how it affects public health, and kind of the most up-to-date news from Washington, D.C. So before joining the ASPPH, he was the senior director for the AAMC, which is the American Medical Colleges, for 19 years. And there he had the honor to be the staff leader, where he conducted various research policy issues that have to do with animals in research, medical education, stem cell research, and facilities and administrative. Through his work, he's had the privilege to publish a lot of his work through JAMA, which is the Journal American Medical Association, and also for the Chronicle of Higher Education and the Journal of the Medical Library Association. So everybody, please help me welcome Tony Mazzaschi.
Terrific. Thanks so much thank you for that nice introduction, and thanks for being here. It's a beautiful state.
Sorry, for folks who are on the Zoom, please open your chat section, and you can type in any questions or comments that you have into the Zoom chat bar, and we'll make sure that those questions get to you, Tony.
Great.
Go ahead.
Thank you. And so I'd like to make this more informal. So anytime you have a question or want to interrupt, if something doesn't sound right or you want to add something, feel free to interrupt me. I don't mind at all. So, I've been at this game. I first arrived in Washington in 1976. And so it's been a long time in Washington, and things have never been wackier. I mean, I've seen a lot of wacky stuff in my time, but it is as bizarre as could be, and hopefully things will sort themselves out, because it's a scary time. It's a scary time for the country. It's a scary time for people who are looking for work, for people who have careers and and feel passionate about issues that are not popular right now. And so let's talk a little bit about the environment and some of the issues. I didn't quite go in the same direction as the blurb, so I apologize for misleading you, but hopefully I'll touch on some of those things. So I first need to tell you just a little bit about where I come from. And so I'm with the Association of Schools and Programs of Public Health. We represent about 107 members, all of the CEF-accredited schools of public health, and all of the major programs. Many of the programs of public health, they're accredited by CEF as well. They're located within medical schools. Our members, 59,000 students, 20,000 graduates, 11,000 faculty. That's a lot of people, but it pales compared to some of the other health profession schools, especially medicine. It's much smaller. And we say we're kind of, we have a policy partnership with federal agencies and others in the community We do a lot of work for CDC and NIH and HRSA and other federal agencies that they can't do themselves. They're prohibited from lobbying. So they whisper in our ear and we race up to the hill to carry their water. But we're a CDC grantee. We have other grants that we get for fellowship programs. And we also challenge the agencies when we think they're wrong. So it's really a partnership. It's a very open communication. It's not unusual for me to call up somebody at CDC and read them the Riot Act, and then 2 days later they call me asking for me to do something for them. It's all above board and perfectly legitimate, but it is a very symbiotic relationship between the federal agencies and the association. And we're a major communication conduit for them. When they want to reach out to CEEF-accredited schools, they call us because we have access to the faculty and the leadership that they don't have. So everything is 1 degree away from being a public health issue, right? I mean, that's why you're in the field, because it touches everything. And yet, as a lobbyist, and I'm the chief lobbyist for the association and registered, I can't take on everything. I mean, I'm a humble human being. I have limited mortal powers, as Superman would say. So I have to be careful about what I spend my political capital on and the association's political capital. So, we have to make decisions. I could spend all of the association's budget on certain things, such as gun violence research. I think that's critically important. It's a sin that there's largely a federal prohibition on gun violence research. I could spend the association's total budget on that and not move the dial. So I would be wasting my constituents' resources. So we have to make some decisions. So I need help doing that because I'm, after all, just a staff person. And I want the leadership to make these critical decisions with me and for me. 1, to give me cover, but 2, for them to realize that trade-offs have to be made, right? I mean, we all make trade-offs in everything we do. So we came up with an advocacy taxonomy, a range of activities that we could do, and then we went forward and decided that I should spend, and the association should spend, 80 to 90% of its time focused on activities where we can be a debate participant, meaning that we have evidence to bring to the debate. That not just that, we think this, but here's the data that we have that can help drive policy. Also, active engagement. We don't want to do anything halfway, I mean, I have a fortune cookie on my monitor, that says, pick your battles that are small enough to win, but big enough to matter. So you have to balance that out. And of course, it's time and place. What was going to be a battle that we thought we could win under Hillary may be a battle we don't think we can win under Trump. So it's time and place as well. And lastly, prime mover. Our first and foremost responsibility are programs that support the schools of public health. And programs of public health, their faculty and their students. So I pay attention to those things first and foremost, and especially if there's no other champion. So for example, you have a prevention research center here. You have a NIOSH Education and Research Center program. I spend a lot of time advocating for those programs because nobody else is going to advocate for them. So that's some of the choices I have to make. So let's talk a little bit about the environment in Washington. And remember, you send the people to us who do all of this stuff. So, there are no congressmen from D.C. or senators from D.C. They don't have a vote. So these are all people from outside of Washington. We blame Washington, but Washington, is pretty impotent. So the first days of the administration haven't been really pretty productive. One of the first rules in politics is to know when to stop digging. Good rule in life, right? You know, you give a line to a professor and it doesn't sell, know when to stop digging. So far, we've not seen that skill evidenced in the Trump administration. They don't know when to stop digging. There's constantly doubling and tripling down on falsehoods and other things. Not a good trait. Secondly, most people, when they golf, try to put the ball next to the pin into the cup, right? But there's always some jerk out there who wants to hit the house to the right or the left of the fairway. The guy at the driving range who wants to hit the little truck picking up the balls rather than hitting it far. So far, that's what we've had. He's much more combative than any president has ever been. And it seems more aimed at causing disruption and chaos so far than to affect real policy change. May change. So in Washington already, there is Trump fatigue. I mean, he has only been in office 76 days. This is his 76th day. And he has sucked the oxygen out of Washington so fast. I mean, does it seem like only 76 days to you? I mean, it seems like a long ride so far. So get ready. I mean, we've got 1,385 days until the end of the term. And if you are a Trump supporter, as I'm sure there's a closeted Trump supporter somewhere in the room probably, 2,846 days to the end of the second term. So, you know, there's a lot of time to go. And any leader, you know, the most powerful position most presidents have had has been the bully pulpit, you know, being the chief advocate. And Trump hasn't used that effectively so far, and you have to use it with discretion, and he hasn't done much in the terms of discretion so far. So this book is the most popular book in Washington after the federal budget. It's released once every 4 years, goes on sale at the government printing office in December after an election, and there's a line waiting for this book. It's called the Plum Book, and it's a double entendre. It's plum because that's the color of the cover, but what it does is it lists all of the positions that the new administration can fill. And so people flock to it because they want to have a job. And this is the book that'll tell you what jobs the administration has available. And so there are all kinds of jobs that a president can name people to. My favorite is the Interlibrary Loan Council of the Americas. Okay? So that's a great, it doesn't pay anything, but it's a nice thing to put on your CV, right? So there are a lot of things, but there's a Secretary of State. Things of that nature. Some things take appointment. Some things are nominations that the Senate has to confirm. Some are secretarial appointments. It's all over the map, and there's not much rhyme or reason to it. To give you an idea, of course, the Secretary of HHS has to be confirmed. The Director of NIH has to be confirmed. The Director of the National Cancer Institute is a presidential appointee. The head of SAMHSA, the Substance Abuse Mental Health Administration, is confirmable. The head of CDC is an appointment by the Secretary of HHS, not subject to confirmation. So it makes little sense because the CDC director has a lot more resources than the head of SAMHSA, but that's the way it is. So what's happened with the administration so far is that they haven't made the appointments that they need to affect policy and change. So the Washington Post and a private think tank have kind of ticked off the 553 key positions requiring federal confirmation. And this data is accurate as of last night. I mean, it's updated in real time. And so 22 nominees have been confirmed. 19 have been formally nominated and are awaiting confirmation vote. 26 have been announced but not formally nominated, mainly because their financial disclosures are either not in order or not complete. And 486 Key positions requiring Senate confirmation have not been even nominated yet or disclosed. So part of this, most people think, is a calculated strategy by the administration of not having people in these leadership roles who can argue on behalf of their agency when their OMB wants to cut their budgets. So we don't have a permanent head of NIH right now. We have a holdover. He didn't hear about the cuts to NIH until he read it in that morning's newspaper. Now think of that. This is a $33 billion federal agency. President of the United States says, I want to cut their budget $5.8 billion, and the director of the institute reads about it in the Washington Post. That's pretty embarrassing. So the sad thing for us, let me just finish this slide and I'll go to you, is that he has left all but one science and research position empty. So there are 46 science and research positions, and there's only been one that's been nominated. That's Scott Gottlieb for the Food and Drug Commissioner. Everything else is vacant.
Just a quick question for you. I hope it was okay to interrupt.
Oh, yeah, absolutely.
So on your previous slide, how do those figures compare to previous administrations?
Yeah, they're way off the map. You know, there may be, at this point in the Obama administration, they were probably down to 100 unfilled positions, mainly because it was difficult to find people with the right characteristics or something came up. But this is like in a different time zone, these figures. So we're really, the science, and the example I use most is the White House Office of Science and Technology Policy, which is the White House Science Advisor's Office. Under the Obama administration, it had 150 FTEs, full-time equivalent positions. Right now it has 0. There's been no nomination of a White House Science Advisor. There is nobody in the office. The space is completely empty. There's nobody there. So the federal hiring freeze, one of the very first actions that Trump, the candidate, promised was to, number 2 on his list of 6 measures to clean up the corruption and special interest collusion in D.C., was to impose a hiring freeze on federal employees. But he said in that he would exempt military, public safety, and public health. So he issued this in the middle of the campaign. When he got into office, he issued a memorandum putting in a hiring freeze. But it exempted only national security or public safety responsibilities. The public health exemption was missing. Well, we raised holy hell, and soon thereafter, HHS acting deputy secretary issued a set of exemptions to the hiring freeze. And they exempted a number of positions that would be graduates from our institutions, including environmental health and safety, epidemiologists. And they exempted with pre-approval some more general categories, including health scientist, administrator, and public health advisor. So, nobody quite understands why the federal hiring freeze was needed. It's not like the federal workforce has been growing. One of the concerns for us, and of concern to you, was how would this affect fellows and interns? And so we tried to ask advice and counsel. The agencies didn't know for a long time. But it finally became clear that if the fellow or intern is paid with a public agency check, like the check says U.S. Treasury, EPA, they're subject to the hiring freeze. If they are paid by a third party, they are not subject to the hiring freeze. So if you are an ASPPH fellow, and we run huge fellowship programs for several different agencies, those fellows are fine. But if you are paid directly by the agency, it's a problem. Now, some agencies are exempting fellows as short-term employees, but it's still an area of some controversy. So the question is, why do this? Because the federal workforce isn't the problem. Federal workforce now is as low as it has ever been. Only 1.93% of the civilian non-farm workforce is a federal employee. And of course, the population of the country, this is adjusted, of course, for the population as a percentage, but it's incredibly small, and many agencies are totally underfunded and under-resourced.
Question from online. With this vacuum of science and research heads, what can individual professionals do?
So we've been working to give advice and counsel on science issues to Congress, but nobody's answering the phone in these agencies, and they don't seem particularly anxious to have meetings with outside groups. So, for example, we've been trying since he was nominated to set up a meeting with Secretary Price, and we've been told he's not meeting with representatives of outside groups yet. So at this point, I think you have to wait until the personnel vacuum is filled in the agencies and instead focus your attention on the bureaucracy, the agencies, and the nominees. Yes?
What is the blip at the beginning of every decade? It can't be the census, is it?
The what?
The spike at the beginning of every decade in that graph.
I think it's census.
It is census?
Yeah, I think it is. Yeah, there's a lot of temporary seasonal hiring for the census. A lot of people went to college on census funds. I'm just guessing. I don't know for a fact, but I would guess. So on top of this, though, there's a new report, updated report out from the General Accounting Office that says that federal employment may face a crisis as retirements expand. And the report says that 34% of federal employees working in this current year are eligible for retirement. And so, of course, most of these people have worked 30 or more years for the federal government. So the federal government is threatened to lose a lot of expertise walking out the door. Now, that's good for some people because it's creating vacuums that will need to be filled, but there's a lot of federal expertise that we're going to be losing. And we're seeing it now at several agencies. The retirements are coming fast and furious at the EPA, because people just don't want to stick around for this turmoil that that they see all around them. And also at the National Institutes of Health, we're seeing a lot of people retire. So there is, in every tragedy there's opportunity. But we are, as a nation, going to lose an awful lot of expertise. And of course, EPA is a special case. They are really targeting EPA. The newest memo says that they're going to cut or reduction in force 25% of the EPA workforce. And now whether Congress will approve this or not, we will see. But there are powerful industry interests at work here, so we will see. So let's turn to Congress. It lost a little bit in the House and in the whole Trump election thing was what happened in the House and the Senate. And the Democrats picked up seats in the Senate, making it much closer. And when an election is, when it's this close, each senator becomes a king in the sense that they can make demands and requests for their vote that they wouldn't normally have the power to do. When a majority is 6 or 8 seats, you can lose somebody. When it gets to 2 votes, you can't lose very many people. So it's often called, every member's a king.
Based on your analysis of the Republican majority in the Senate, how many are left that are actual swing or moderate or gang of 8 type legislators in this
there are
term?
Some. We saw that happen in the ACA debate with people saying that they would not vote for repeal only, that it had to be repeal and replace at the same time. I think it varies by the issue. Clearly, there are people that you can pick out that are at odds. I mean, the people, Susan Collins of Maine, There aren't very many, though. I think there are more on, it depends on the issue. On the defense side, there are some people, in support of NIH. You'll have a lot of Republicans opposing the president on any reductions in NIH. It's pretty idiosyncratic. So So anyway, it's pretty tight, and of course Pence is there if there is any tie to be voted on. Went the wrong way. So the trouble, the one thing to keep in mind is it's not going to get any better for the Democrats in 2018. So those seats that are up for election in 2018 were last up when Obama won his second term. Remember, the Senate term is 6 years. So these are people who won in a presidential election year, which often has much higher turnout. And some of these states that are represented by the Democrats voted heavily for Trump. So, for example, West Virginia, North Dakota. These are going to be difficult for the Democrats to hang on to. Indiana is always a swing state. And West Virginia is probably the most problematic state for the Democrats. But just the numbers, 25 Democratic seats are up and only 9 Republican. And so for the Democrats to pick up 2 seats, they really need 3 for a majority, given that Pence can break any ties, is almost unimaginable. It would have to be a wave of, Old Testament biblical proportions. I mean, it's something like we've never seen in politics before. Now, it is true that a sitting president whose approval ratings are under 50%, their party tends to lose pretty handsomely in the midterm elections. But that was before gerrymandering became so ubiquitous. And the Senate lineup, I don't think, has ever been this stratified. So the House, right now, there are 5 vacancies now. This was right after the election. There are now 5 vacancies. The Democrats would need to pick up about 25 seats, give or take, depending on how the special elections work out, if they were going to take control. In a normal mid-year election, that might be entirely possible, but many of these Republican seats are heavily gerrymandered, and Democrats probably don't have a chance in many of them. So this would certainly be, it's more plausible to think that they could take over the House than it is to take over the Senate, but still very unlikely. You've all heard that the House is in disarray, mainly because of the Freedom Caucus, which is a group of 33 to 40 members who are very conservative. It's an outgrowth of the Tea Party movement. One listing of the ideological divisions in the House gives 33 members to the Freedom Caucus, and also 48 members in the more liberal wing, and I use liberal cautiously. There are no liberals in the Republican side these days. Similarly, Progressive Caucus in the Democratic side, 69. The Blue Dog Coalition, which used to be the Southern Democrats, down to 11. Many of those seats that were Blue Dogs are now legitimately Republican seats, which really reflects how most of those people voted anyway. But if you take the Freedom Caucus numbers away, you don't have a majority. And we're still in a majority. We're not a parliamentary system. You need a majority. And this is why the Freedom Caucus has the power it has. Yet Trump, after the ACA debacle, went after the Freedom Caucus. This was the tweet he sent out last weekend: we must fight them and Democrats in 2018. And so you start thinking, where does he think he's going to get the votes? I mean, you need to get a majority vote. And you don't piss on your friends. And that's what he does all the time. So anyway, we'll get back to that a little bit. Our schools and members are really reliant on federal income. I mean, we are at the federal trough big time, much more than medical schools are. The average faculty member at a school of public health or a program of public health takes in about $100,000 or more in federal support. Medical schools, it's only about $50,000. So the key number here is grants and contracts. $2,092,000 come to our schools and programs. Tuition and fees, about a third of that. University state support. And that's been going down markedly. The federal support largely comes from NIH, 60% of it. NIH is still the giant funder of our schools and programs. And it's interesting because there is no, of course, Institute on Public Health. There's no Institute of Preventive Science. It is spread. There are 26 institutes and centers at NIH, and our funding is spread throughout those 26 institutes. And that is good for us because, one, there's not a target that you can go after, both in a positive and unfortunately negative way. As an advocate, I'd love to have a line item that I can advocate to grow, but remember that line item also gives people who don't like you a target to pick your pocket. Altogether, our schools and programs get funding from 18 different federal agencies. And some are pretty surprising. You know, we get a lot of money from the National Highway Traffic Safety Administration. We have 10 fellows working at the National Highway Traffic Safety Administration right now. So, but we're very reliant on federal money. Indirectly, we get a lot of money from state health departments under contracts and other obligations. 53% of state health department funding comes from federal funds. The health commissioner was here just a few minutes ago. He said it's 55 in Colorado, 55% in Colorado. When I was growing up, education was a state and local responsibility, not a federal responsibility. There was almost no money from the federal government going to education. There was no Department of Education. Now, there's more money going to education from the federal government than there is from the state government. You may have heard, it's said that universities like Colorado are now state-located rather than state-supported. With the funding crisis at the state level, they don't have resources. That's why you've seen tuition go up, because state money has gone down the tubes. And lastly, you know, the federal aid per graduate student from federally guaranteed loans has skyrocketed. Now, this is a complicated chart, but based on 2013 dollars, it was up to $16,000 per graduate student per year. In the last reporting year, 13-14. And this is a federal expenditure, and of course, to the extent that these federal loans are used to pay tuition, it benefits the school. So saying the student loan volume has escalated. The blue here is direct funding from the federal government, guaranteed loans from the federal government. The red are privately issued loans, but backed by the federal government. And of course, the Obama administration tried to push the commercial companies out of the equation because they were taking no risk in getting a lot of money in fees. The Trump administration is much more likely to be favorably disposed to companies and not to direct lending. There are people on the Hill in great power that would like to get rid of one of these loans, and that's the Grad PLUS loan. I don't know if anybody here has a Grad PLUS loan, but Lamar Alexander, the chair of the education panel, it's really the help committee in the Senate, does not like the Grad PLUS loan program. He thinks the federal government should not give loans to graduate students because they earn so much money at graduation, they should be on their own. Now, he's really talking about medical students when he's thinking medical students, not public health students, not social workers, etc. But that's his mantra these days. And the Higher Education Act is due for reauthorization. So there will be a vehicle on which they can attack this. One of the problems, though, is that this loan program actually makes money for the federal government. They make money on this. So, in fact, it would have a negative budget consequence. So whether it will carry the day or not, we don't know. The other loan program that is up for modification, and dangerously so, are some of the income-based repayment plans. And there's one in particular that the Republicans have not liked, and that's the Public Service Loan Forgiveness Program. So this is if you work in a public service job, first issue, definition of public service, you pay continually for 10 years, your loans are then forgiven. Repayment is based on an income formula early in the loan cycle, and it's a way to encourage people to go into public service. One of the benefits of this loan repayment program over other loan repayment options is that the amount forgiven is not taxable. So if you get a loan forgiveness on the pay-as-you-earn program, that loan forgiveness is taxable, and it can be a major whack. This is a great program for our students, but it's also a great program for lawyers and for medical residents. Federal government says, why are we forgiving loans of a cardiothoracic surgeon who is making at year 10 $500,000 on average when their repayment schedule is based on their salary as a resident? Good question. What is the definition of public service? This is a real tough one. There was a loan administrator that was issuing letters for the program, designated people in their positions as eligible for the program. The Department of Education, toward the end of earlier this year, said that one of the letters was wrong and that a person doing work for the Veterans Disability Group doing disability appeals was not in public service. He had a letter. He had stayed with the Veterans Group for 10 years. In October, was planning to file for loan forgiveness. October of 2017 is the first time, it's 10 years after enactment, the first time that it can actually be used. They turned him down, which seemed really unfair to everyone. So it was a lawyer and the American Bar Association and the lawyer and a number of other people similarly affected are in court now fighting this post facto determination. But the question that Congress asks is, what is a public service position? Does it include a public defender? Well, you and I would think, yes, of course it affects public defenders, but they want to kill the public defender program, right? So there's some argument about it. There is a policy concern in that they don't know what the government's liability is for this program. You know, we don't know how many people in October of 17 will apply, and thus it's really an entitlement program. If everybody eligible applies, the government would be on the hook for everybody. It can't plan for that. It's not an appropriated fund. It's really an entitlement. So we may see some changes in this, and this program is really important to those students, especially those who go to work for state and local health departments. So we're paying attention to this. But right now, it's going to be resolved in the courts. In Washington, we've been stuck talking deficit politics for a long time, 10 years or so. And you can see why. The projected deficit is off the map. The focus, though, on how to affect change here has been focused on domestic discretionary spending and not the mandatory spending programs like Social Security and Medicare that have really driven the increase. So when you focus only on a small slice of the pie, you're only going to have a small impact, but it can be particularly devastating. Our programs are in the non-defense discretionary income. Of this total pie, 3% goes to education, 2% goes to science and research of the whole federal pie. So, you know, unless you're willing to approach these other accounts, you're not going to really make an impact on the deficit. But meanwhile, we're getting clobbered. And here's the discretionary line. And as you can see, it has gone down steadily. And this is a percent of gross domestic product. This is a lot of money. And so all of the discretionary accounts, which are most of the things that you think of as government, are being threatened. Some key budget dates going forward. Right now, we're in fiscal year 17. Can you go to your right? Oh, sure. Oh, sorry about that. We're in FY 17 right now, which started on October 1st. Last Saturday was the 6-year mark, so we're a 6-month mark, so we're halfway through the fiscal year. They have not passed a budget yet. Only one of the 12 regular appropriations bills have been enacted. And so we've been working under a series of continuing resolutions which pay out to agencies that they can continue operating at the same rate as the last bill that passed, which was FY16. The continuing resolution expires on the 28th. It appears as though the committees have reached agreement on most of the major items in the bill, on these appropriations bills, which we merged together into an omnibus bill, and that it will be enacted before the April 28th deadline. The new fiscal year starts on October 1st. Normally, the president presents his budget to Congress the first week in February. By statute, has to present the budget. It's always a problem when you have a new president, though, because that's only weeks after inauguration. And preparing a budget's a big deal. So this time, Trump was given authority to present a skinny budget, which is just some aggregate totals. Those aggregate totals were presented to Congress on the 16th of March. They called for some massive cuts. He will deliver to Congress on May 15th his full budget proposal. And obviously, we're going to see what that holds. It's not going to be pretty. On October 1st, which is the start of the next fiscal year, 18, it also is likely to be the date when the debt limit needs to be extended. The ability of the Treasury to borrow to pay our bills. There are many Republicans who have never once voted for a debt limit extension. So you're going to need some Democratic votes. So the Dems may have some leverage in a grand bargain that includes appropriations and the debt ceiling. But it's going to be an uphill battle. So Trump, when he issued his skinny budget, did not give details on how it would affect every federal agency, but he did have some. And it's important to recognize that these cuts come on top of reductions that have already happened in many of these agencies. So he's calling for a 28% reduction in EPA. That would bring the EPA cut since 2010 to about 52% of the EPA budget. Pretty devastating. Same for all these other accounts. The impact on NIH, which everybody views on the Hill as being a favored account. Everybody loves NIH. But the spending hasn't kept pace with inflation. So the NIH budget was doubled in this period. This is sort of the end of the doubling period. And since then, it's lost power. It should be, if it kept at the same rate. I mean, this is the raw dollar, but this is the purchasing power. So you can see we're back now down to about the 2001 level of spending. So within the Trump proposal, there were some nuggets, or turds, depending on your perspective. One thing he wanted to do, he's going to cut the NIH budget by $5.8 billion. It's $33 billion right now. He also wanted to take the Agency for Healthcare Research and Quality and fold it into NIH as a new institute, but not give it the money that it had. Its current budget is $400 million. That money would not move to NIH. So how it would be funded, no one knows. He proposed doing away with the Fogarty International Center. Running throughout the proposal for 17 and 18 is his dislike for any program related to global health, international activity. It's all very domestically focused, totally in line with what he ran on. And of course, the cuts to EPA, massive. So after that 18 announcement, he also came back to Congress and said, I want money now, and I want you to cut it from the FY17 appropriation, which we're halfway through. So the impact on an agency, if you cut your budget retroactively, it's very difficult to do. And what did he want the money for? He wanted to cut $18 billion to make an initial payment for the wall. Total wall cost now by the Customs and Naturalization Service is that it will be at least $70 billion plus land acquisition fees. but we need $18 billion right now to start planning for it. And so he proposed cutting in 17 these accounts, along with many, many others. And the ones to pay attention to, not just NIH, under public health programs, he wants to cut the injury prevention centers, the prevention research centers, which you have here, HRSA, the public health training program, one you have here, NIOSH, he wants to cut the education and research centers, which you have here. He wants to cut all kinds of international programs. The appropriators said, we're not going to consider this. We might consider it as a supplemental later on, but we're too close to a deal on the bill to take this into account. This would blow up everything. But these cuts are likely to come back. They are very much likely to be proposed for these agencies in 18, the budget that we see on May 15th. One of my concerns, and the concerns of a lot of people, is that, as the budget shrinks, there are lots of people who feel very passionate about either their program or lots of disease groups, rare disease groups. They will do anything to fund the research that they need to save the lives of their loved ones or whatever. And the only way you can actively lobby these days is to propose cuts in somebody else's account. So we've had some really atrocious behavior already. American Heart Association went up to the Hill with a list of ratios of deaths per research dollar and basically called for cuts in funding to HIV/AIDS because it is high ratio compared to deaths right now because of the success we've had versus heart conditions. So it can get really ugly pretty fast. Dick Krugman, who was the former dean of the Colorado School, was a Robert Wood Johnson Health Policy Fellow. And when he was a Health Policy Fellow, he mentioned this at a meeting, and I've never forgotten it, about, when you're chronically physically hungry, it's hard to have good table manners. And that's true in the advocacy world as well. It can be pretty cutthroat when you want to pick somebody else's pocket, even if they represent a cause that may affect your institution just as much. So let's talk about ACA. I'm not going to go through the, who shot who. But remember, the ACA is now 7 years, and it finally is popular. After all the effort to educate the public and sell the program, it was pretty unpopular until they tried to kill it. I call it ACA repeal rather than health reform because there was no health reform in this bill. It was mainly just we'll take a tax cut and we'll kill the ACA, but there was no real plan to affect real change in the health system. One of the rules of politics is you don't murder someone who's committing suicide. Sounds reasonable, right? Why would you murder someone who's committing suicide? If you think the ACA is going to die on its own, why would you murder it? And the impact of this will come back in a second. The very first line of the ACA reform bill that the Republicans introduced would kill the Prevention and Public Health Fund. It provides about $1 billion a year to CDC, 12% of its budget for prevention activities. And that was the very first thing in the bill that they wanted to kill. It's interesting, essential benefits now all of a sudden is an issue. And, we had some things that the Republicans had to meet. You had to be able to insure your child until 26. You had to have pre-existing conditions. All of a sudden on the must-do list are essential health benefits. That's a big contest. People understand now what essential health benefits are. That's been one of the real lessons of this is all of a sudden essential health benefits are in play. So, one of the things that made it popular was this picture that was the most popular posting on Facebook. So, they were deciding, it was billed as, they were discussing essential health benefits, but it was sent around as saying that they were deciding if maternal care and mammograms were essential health benefits. And if you notice something about the picture, not too obvious, it's all men. Later came out in the Washington Post that this is purposeful. that the Trump administration has a policy of doing this. This is about the 5th or 6th time they've done it. And I would urge you to look up on the Washington Post the article about this picture. This was intentional because they think works and they've tested it with their base. It's pretty gross, really, when you think about it. And of course, the internet, in its classic way, then came up with a classic meme, which many of you might have seen, that with dogs discussing feline essential health benefits. Get the point across pretty well. So one thing that the bill did not do was go after the $6 billion in money that goes to the Center for Medicaid and Medicare Innovation, which fund innovative models of care and payment, many of which are designed to advance the triple aim, which came from the Institute of Healthcare Innovation, which focused on population health. And this was one of our big concerns. Population health, which often focuses on going after social determinants of health, is essential for us. And so that was the one good thing. They didn't go after CMMI and some of its modeling. All the press has been about the Freedom Caucus and how they killed the bill. It's true, but this man killed the bill. How many of you have ever heard of Rodney Frelinghuysen? Been around for a long time, worked his way up. He's now chair of the House Appropriations Committee, which is probably the most powerful committee in the House of Representatives. It's called A Committee, Ways and Means, and others are A committees. He is chair of an A committee. He announced that he was going to vote against the bill, and it was pulled from the floor less than an hour later. He killed the bill. And he killed the bill because it would have negatively affected New Jersey's Medicaid program, which he was committed to preserving and protecting. It used to be that party loyalty was important up on the Hill. If you went against your president, he is a Republican president, if you went against your speaker, you could not be an A committee chairman and vote against them. So I was at a meeting with some old politicos, and I arrived on the Hill right at the end of the Vietnam War, and nobody could remember an A committee chair bucking their speaker and their president since the Vietnam War. And what it told other members was, I'm not going to be punished for voting against this bill. Therefore, you can vote against the bill. And the vote totals and the whip counts were starting to enter in 80 votes against ACA, largely driven by Rodney deciding not to vote for it. He represents Newark. So he's on the outs with the leadership, but that was one of the more critical and important moments. But one of the things that happened...
Should we be thankful for him and what he did from a public health perspective? Put that into context for us.
If you wanted to maintain the ACA, sure. Yeah. I wouldn't make the assumption, though, that everybody in the public health community wanted the ACA to stay afloat, but, yeah, I think so. And he has gotten a lot of validation. His polling numbers in New Jersey went sky high. All the newspapers editorialized about him, what a courageous man, bucking his president, that type of thing. So, but we'll see in the long run, Going back, one of the major damages here was Paul Ryan, the speaker, who billed himself and tried to have himself portrayed as a policy whiz. The core problem with the ACA repeal bill is that it was a dog of the first order. It was poorly drafted. It had no conceptual framework. The list is legendary, and everybody agreed to it. Everybody agreed it was a dog. But, of course, it was a political bill, not a substantive policy bill. And he was the champion of that. His reputation has really taken a hit. Polling numbers, I had a chart about his polling numbers after 40% of congressional staff said they've lost faith in Ryan. Roll Call runs a poll of congressional staff. But why is he still Speaker? And the reason he's still Speaker, and I think it's absolutely true, is, as somebody said, nobody wants to be Henry VIII's next wife. So, John Boehner had the same problem with the Freedom Caucus as Ryan is having now, and whoever takes his place, the problem doesn't go away. So, we'll see. Well, healthcare, as you may have heard, they tried to resurrect it this week, and the Republicans will keep trying to resurrect it. And I loved this one that was in the Daily Beast. Zombie Trump care returns to terrorize House Republicans. Most House Republicans would love to see this issue go away. Let's get to tax reform. Now, that's something that contributors are happy with. It's something I can touch and feel. I know what the answer is. Cut taxes. I don't know what the answer is on health care. And one of the reasons they're going to keep trying is everybody realizes that it benefits Democrats a lot if the ACA stays. Even the staff people, think 67% of it think the Democrats benefit big time. But more importantly, the Republicans are in an untenable position. So, the Pottery Barn law, which is, if you break it, you own it. Republicans have touched it, and now any problem with the ACA, people are going to blame on the Republicans. Right? You touched it, you broke it. Whereas his supporters on the other side are still unsatisfied because they wanted Trump to go. They didn't care whether 24 million people were out on the street or not. They wanted it dead. So they have pleased no one. And so they're getting it from both sides. So they will continue to try to push this along. And as they do, there are some, I left off the things, but there are some things you might want to look for. The Congressional Budget Office, which took a lot of heat during this, issued a decision at the end of December defining what coverage meant. The Republicans had been counting on coverage light being counted as coverage. That if they give everybody just a small health savings account with massive deductibles, that would still be counted as coverage. CBO issued in December an edict declaring what coverage was for CBO purposes. And that's the test they failed. If CBO changes the definition of coverage, it will change all of the projections of the bill. Similarly, when they did their projections of the bill, they did not do a dynamic scoring of the bill, which is now required of Republicans push through a requirement that they do dynamic scoring, which is macroeconomic effects of a bill. So, if you do a tax reduction, what are the impacts beyond the initial money that's saved by an individual taxpayer? They go to 7-Eleven, they buy hot dogs, the hot dogs are bought by, going all the way down the line. And Democrats think direct impact of legislation is hard enough to measure. To go into the dynamic scoring is really, really problematic. So if they have time, they will do dynamic scoring, and that will change the amount of money saved by the bill and improve the deficit reduction numbers, making it more appealing to some of the deficit hawks. The only other two things I'd mention, obviously some states are reviewing whether they want to jump into Medicaid expansion. It just failed by 3 votes in Kansas. We're likely to see a few other states jump in. And there's also a legal case that's critically important. It's called Section 1402. It was the Affordable Care Act said that the federal government should make payments to health insurers under the exchanges to help reduce the level of deductibles and co-pays. So it's stated in the bill, but it was never formally appropriated in the bill or authorized. And so the legal eagles on the GOP who were looking for something to bring this down found that, went to court. There was an injunction placed against it. There's a major hearing at the end of May. The administration announced last week that it would go ahead this year and make the payment even with the litigation pending. But it could drastically affect the coverage of 7 to 10 million people and how much they pay for deductibles and co-pays. And if that happened, many of the insurance companies would pull out of the market. So we'll see how that goes. There are other issues. I'm not going to get into them. Obviously, immigration's been a big issue. The whole climate science evidence is scary. There's been an effort to attack geospatial data on health disparities and to prohibit any federal money from being used to use geospatial data. This is a local zoning issue, and we're caught up in it by faulty and poorly written legislation. We've been trying to kill it for months now. And the workplace wellness, there was a bill passed under the Energy and Commerce Committee that basically threw out the genetic discrimination law and could require employers to require their employees to take genetic tests and provide the results to the employer. Okay? Well, think of that. I mean, this is a Republican Party that wants individual liberty. And remember, that genome is not just yours. It affects your children and their insurability. If something is found in that genetic profile that leads you to have difficulty getting insurance, it will also affect the ability of your children to get insurance. It's madness. Anyway, we're trying to kill that as well. Going forward, Trump obviously has a lot of work to do. He has sent out tweets in the last couple of months attacking senators left and right. You know? I mean, it's just over the top. Pathological. I mean, what is he doing? So, you know, what a stiff Lindsey Graham. Great state of Arizona has a very weak and ineffective Senator, Jeff Flake. Jeff Flake votes conservative 99.9% of the time. You know? So if he wanted some unsolicited advice from me, and he doesn't, and he's never asked me, you know, the ones I would say is first fill your vacancies. Get the government up and running. And, you know, stop insulting people. You're going to need them sometime. Today's enemy can be tomorrow's ally. First thing you'll learn in lobbying and advocacy, don't unnecessarily make enemies. Right? Stop issuing ultimatums. Politicians don't like ultimatums. You're not buying a condo. I mean, this is, you know, it's not a take it or leave it situation. Start building a governing coalition. Where do you get the votes to get a majority? You need a coalition to do that. Count votes in the Senate before asking House members to walk the plank. So Trump wanted the House to vote on the ACA repeal bill, knowing that it didn't have a ghost of a chance in passing the House. First, the parliamentarian would have struck half of it as violating the Byrd rule under reconciliation because it didn't affect just budget issues. You can't ask one chamber to cast a deadly vote that's going to cost some of them seats when you know the other body is not going to approve it. You know, you do walk the plank votes when it's, you know, you got to have it and the other body's going to pass it. Don't cede policy development. The administration had almost no involvement in the developing of that ACA reform bill. It is now taking the lead at developing the tax bill, but you can't cede policy to the Congress. You've got to know what's in a bill. And to know what's in a bill, you have to know what you're talking about. You have to read it. So one of the great moments in this whole debate was when Trump had the Freedom Caucus in. And one of the Freedom Caucus members said, you know, I want to talk about the essential benefits debate. And he said, I don't want to talk about the little shit. Let's talk about what this will do to my presidency if I don't get it. So he called essential benefits publicly little shit. Well, it's not. I mean, it's big stuff. He didn't know what essential benefits were. He couldn't name 3 of the essential benefits when asked. You have to know your stuff. And as president, you have to be at the top of your game. Now, Obama got a lot of criticism for being too detail-oriented. But boy, it made him a powerful negotiator. You're not a powerful negotiator if you don't know your game. And it takes work. It takes work. And start building some credibility. You know, he doesn't have much credibility, and his polling numbers don't add to that. They're not particularly scared of him up on the Hill right now. You know, you want to be scared of your president a little bit. That's how you get votes. Nobody's particularly scared of him right now. So this is an article I would urge you to look up online when you go back and do a search. Michael Bloomberg, the former mayor of New York and one of the richest people on earth, wrote this op-ed. He's got a new book coming out, co-written by the former head of Friends of the Wildlife. And he makes the claim that one of the benefits, lowercase b on benefit, of Trump and his attack on climate science is that cities, localities, and business are coming out of the woodwork to affect local change and put a stop to some of the stupid, egregious things that Trump is proposing. That there is, in fact, a consensus among the business community not to buy dirty coal, that most companies will not purchase electricity produced by coal. Building local and state and community and business coalitions is going to be increasingly necessary as a line of defense against some of the atrocious things that Trump is proposing. And I think he's absolutely right. And I think our graduates and public health professionals are in a unique position to organize communities to advance health. I mean, the most powerful thing you have is you are a health informant to your communities. And I think you can affect change even while Trump is sitting in the White House. So that's my presentation. Sorry I went so long, but I'm happy to... Oh, and this, I should... One of our recruitment campaigns is called This is Public Health. But for the March on Science in Washington, we played around with our logo a little bit, and we're selling T-shirts online for people marching called Science is Public Health, so that in the March for Science, there's a good public health presence. So you can even get one for your dog and everything online. So anyway, thank you very much. And I'm happy to take any questions. You're probably too exhausted by that, I'm sorry.
William will go around, and we have to do it with the microphone for the folks on the computer.
Great talk. Thank you. A quick question for you. It's about the strategies of debate across the aisle. So I've been reading about how are some of the issues that seem to the left side so obvious and so important and so backed by science and by fact, we're just not being heard, we're not communicating well. And one of the hypotheses I read was that it's a evidence-based, fact-based proposal of some of these issues that is being faced with a interest-based, belief-based, value-based response. So we're arguing facts to feelings, and we're just completely missing each other. Right. However, some of the things that you said tonight about, Republican interests are very fact-based, are budget-based, and I'm wondering about that assertion that I read about. What's your opinion of it? And wondering if that is the case. So we're building all this fantastic evidence to make solid policy, but if we're not being heard and it's not going anywhere, what do we do about that?
Oh, a great question and a hell of a challenge, and boy, do I wish I had an answer for you. I will say in the personal advocacy, if I go in to talk to a member and I give him a data sheet, I mean, maybe it'll sing, maybe it won't. But if I bring a constituent in who's local, who has a narrative story to tell, that is almost always better. Now, the staff might, the technical staff behind them might want the data, but, most members want a story. And so, the stories need to be factual and often evidence, and should be evidence-based. But I think you have to have the combination. To get a member of Congress interested, you have to be able to tell them a story. Now, I will say, we have failed in many ways on the communication front where it's a constant challenge. There were some examples given earlier in the panel discussion. We've clearly failed with a large sector of the community on vaccinations. We continue to fail to get people to believe that their individual actions have an impact on the community at large, which also feeds into the vaccination, that you have a responsibility to your community, much like your community has a responsibility to you. We've lost a lot of that over time. I'm not sure how to get it back, and it clearly has to be, one that's heavily tested. There's such communications overexposure now, with so many voices talking to people endlessly, that boy, it's hard to overcome the power of the mass media, Facebook, and everything else. But I do think it's true. I mean, you have different people hear different things. And there was, I didn't show the slide, but there was a column by Peggy Noonan in the Wall Street Journal on Friday. Peggy Noonan was chief speechwriter for Ronald Reagan, and she's not somebody I like. I mean, I can't stand her. She writes for the Wall Street Journal, and it's typical Wall Street Journal editorial page stuff. But she did have a good point in a column and said that she had been doing interviews with Trump true believers, and why they were holding so firmly to Trump, even in spite of evidence of his lies and some of the incompetencies. And she said she thought that a lot of it had to do with that they get their ideas about the presidency from reading and from popular television shows like Scandal and House of Cards that kind of portray that almost anybody can be president, And it belies the fact that the White House itself is really an organism where truth and policy development, integrity really matters. And Trump is running a White House that, sings to that first cohort, and the organism of the White House that allows the government to function is still in embryonic stage, and whether it will ever mature under Trump is going to be the real challenge. So anyway, it was an interesting, about that juxtaposition and what one thinks the presidency is, what it can do, and why people are still with Trump. He said it himself, he could shoot somebody in the middle of Times Square and still get elected. With that 36%. That 36% doesn't get you very far, though, when crisis comes along.
Just a reminder for those who are on the chat, use the chat function to type in your questions.
Thanks again for coming. This is a really informative talk. I don't know if I'm leaving here more optimistic, but it's very informative. You were mentioning earlier about gerrymandering and that issue. I know that Eric Holder's starting, it's rather nascent, but a national conversation or program to work on getting our districts back to a more normal composition. How much are you hearing on a federal level? How much, as far as support? I know the majority of it's going to come from the Democratic side, but how much steam is this picking up? I know 2020 is the year that the majority of redistricting is going to take place. So I'm interested if this conversation is picking up more steam.
Yeah. Well, I think it's getting mixed up a little bit. It's not much of a conversation in D.C. It is what it is. It's a state level, issue. Obviously, the Democrats have done very poorly in state legislatures, and the Republicans have been very skillful. And with the support of some conservative funders who have championed and underwritten most of the movement, they have funded analytics projects and firms that have provided Republicans in state legislatures with data on how to do it. And some of the most egregious things have been stopped by the courts. I think it's going to be, as we saw in North Carolina, with taking powers away from the governor, that we're in an environment where almost anything goes. And I think the next census, there'll be another redistricting effort. And unless you have control of the legislatures, you're not going to do very well. I'm sorry, I just don't. I do think the courts can play a role. One of the impacts of the gerrymandering has really been to disenfranchise the poor and minority voters. It can be done in various ways so that it passes the test, but that's the indirect or direct impact of it. So, you have lots of districts now that are 90% Democratic and, 54% Republican.
I'll ask a question. I was wondering if what your thoughts are on the future of the Affordable Care Act, and if also you can give your take on a single payer system, if you think that could be a possible remedy to our spending for healthcare.
I don't know. Some people still hold. I've got a couple of socialist friends who still, have single payer bumper stickers. I was struck. Charles Krauthammer, who is a physician but very conservative columnist, said that he thought the debate had led him to believe that single payer was coming. When you combine the feeling that health care is a right with the essential benefit package, you get close to Medicare for all. Now, I have a hard time believing that the body politic is willing to move in that direction, but it's a great debating point. I think the Affordable Care Act, the problem with the Affordable Care Act is all Democrats start off by saying, it's not perfect, but. Well, part of the reasons it's not perfect, not that anything is ever really perfect in the legislative world, is that there have been no opportunities to amend the law. When you look back at the history of the Medicare program and the Medicaid program, there were hundreds of changes to the program based on evidence and experience. I have to say, the Affordable Care Act made all kinds of behavioral economic assumptions that have proven to be false. Same with the Republican proposal. It's packed with behavioral economic arguments about how people will behave based on economic incentives, almost none of it backed up by any evidence. So part of the problem has been that the political dynamic doesn't allow change to tweak some of the imperfections. We're approaching the point where if we don't have some changes to it, part of it will falter to such an extent that people will perceive it to be a failure. For the most part, there's been an over-publicizing and over-concern about the exchanges. And the exchanges really are a very small part of the Affordable Care Act, but get the most publicity. So, it took 20 years for the last state to accept Medicaid. Arizona, on the 20th anniversary of the Medicaid program, agreed to join it. It took 20 years. So, we're at 33 states have gone through expansion. In the public health world, we've got to think long term, right? And so, we've got time.
Please give us 2 or 3 positive nuggets that can inspire this group.
Yeah.
Something that is really going on around the public health world. We've got students who are not only starting, but some folks in this group who are about to graduate. Some are in policy, some are here just to learn about applicability of policy to their areas. But on a federal kind of public health policy level, give us some optimistic things going.
Well, a couple that one I'd point to is related to the ACA. Right after the election, if you read all the newspapers, you thought that the ACA repeal was inevitable, right? You couldn't have gotten money in Las Vegas that the ACA would still be standing right now. So I think the lesson there is forget about the rhetoric and the conventional wisdom about the direction of politics. Nothing is inevitable. And I think that should give you solace, especially in the environmental health area. We can combat some of these things. People who have been quiet will find their voice. The other one I would say is, I have found over the years that people do appreciate the truth, especially people in power at some level. So I think we bring truth to power, and we should hold on to that we can really make a difference in the long run. I think we can have more of an impact locally than we are having. One of the great problems with both the Republican and the Democratic Party is they have really weak benches. I think even people in power would tell you that. We need to build an educated group of concerned citizens who are informed about how the future direction and the future choices we have, and I think you can really help do that. So I think there's lots of opportunity for you to affect change and help direct it. Great. Thank you, everybody.
Thank you. Folks online, this is the end of the program.